Good afternoon, everybody. It is so excited to be here as with Newfoundland and Labrador Health Services 2024 Innovation Summit. My name is Ayon. I'm a VP with Seafair and President of Branch Innovations, and we're proud innovation partners with NLHS. We're involved in a couple different projects and really rooted in this notion of impact, efficiency, and really putting the patient at the center of our work. We figured what we'd focus on today is actually TxtSquad, and this is Josh, who you've heard about. He's the co-founder and CEO of TxtSquad, and they're a local startup that's really transforming healthcare communications. So the title of this session is, how do you introduce innovative software into the Canadian healthcare system? I know there's a lot of experts, practitioners, technology providers here, a lot of folks in the system, so we're just sharing our perspective, and we figured we'd share a little bit about the journey that TxtSquad has been on to take you through what the experience has been like for us. So, as with any startup, the fundamental component is problem identification. And I would say it's not just identifying the problem, but it's framing it appropriately for what you're trying to solve for. So when we first started to explore how TxtSquad could create value within healthcare, we were reflecting on what were we hearing, what were we seeing, what was happening in our backyard. And one of the things we knew was that there were newer models of care that have a tremendous opportunity to have impact on Newfoundlanders and Labradorians. A really good example is family care teams. And these new models of care were being paired with old models of communication. And the symptoms of this mismatch were showing up in multiple different ways. We had high no-show rates, we had frustrated staff with repetitive workflows, and a poor patient experience. We knew that to address this, really, we had to think beyond the notions of scheduling and notifications and really dig down to the fundamental component of what is the core communication experience between patients and their clinics. So this is where texting comes in. Texting offers a very simple yet transformative opportunity. There's no app needed for texting. Upwards of 90% of most population centers have access to a smartphone or are comfortable texting across the socioeconomic spectrum. Texting has an incredibly high response rate, especially when compared to phone calls, voicemail, and email. We also know that through texting, you can eliminate some of the traditional friction and frustrations that come with phone calls and voicemails. You think about phone tag, checking your voicemail, try to get in touch with somebody. Texting can have higher rates of engagement with lower rates of kind of real-time conversation. It can be asynchronous. And texting is technology. So through that core platform, you can start to unlock different automations and efficiencies in workflows that just aren't possible with traditional communication technologies. And so we can reduce no-shows and we can reduce wait times. So this is where TxtSquad comes in. It's a two-way texting solution, and through TxtSquad, we've brought this to NLHS. We've been thinking about the use cases and worked closely with the team here. It's a two-way texting solution, and what we're really focused on is offering clinics and their staff a simple and clean interface for patient communications. We want to provide patients a communication experience that they're familiar with, that requires no logins, no applications, and we want to give providers a core platform upon which you can really drive automations and efficiencies and think about future opportunities through AI. So I'm going to pass it on to Josh because he's really the brains and the team behind this.
Well, once again, Ayon got me on the stage, which is all that really matters anyway. I'm dying now to go on about how texting is about an accessible communication channel and how it's a medium for AI and how it sounds like an old technology, but it's just starting, and how apps have just created too many barriers to engagement. But that's our talk tomorrow. So I'll get on that tomorrow when I talk about the results of our pilot. The goal today is to talk about how you get here as a startup, and also to kind of give the other side of the perspective that Ash gave, and ours has images. Too soon? I got a solution for that. Just kidding. So essentially that is TxtSquad right there, but I say I'm a startup, but really this started in 2017. We were building an analytics platform for a company, Garage Kings, and I couldn't get anyone to really use the analytics platform, which is really interesting. The fact that we expect people for healthcare to download an app and log in and book and do all these things. Meanwhile, in organizations, you can't get app adherence, right? We all know this. People won't use the app, they won't use the internet. Oh, we built it, but they won't use it. It's a common problem. Well, 2017, we started to use text to drive engagement, basically just to speed up a sales funnel. It went great. said, you know what, I'm going to deploy an enterprise texting system with a good API that I can work through. Did a market scan, couldn't find one, so I built one. And then we started working with communities, and we hit the school lunch program. So this is about 4.5 years ago. And all of a sudden, they came to us. They had 30% engagement. We said, we'll get you up to 60, 65, maybe 70. First week, 95% engagement. Light bulb went off. A doctor reached out to me at the same time and said, we should be doing something in healthcare. There's a gap in texting, and this journey started. And TxtSquad still services school lunch programs in Nova Scotia, PEI, Quebec, Newfoundland, and many other community-based organizations we're very proud of, but we're a healthcare-focused enterprise. And Ron stated our mission very clearly. That was when we started to partner with Seafair, and they're vital to our journey. And that journey extended from us going through a whole regulatory HIPAA compliance process, and with NLHS innovation team. They're on the back end there, but they're very much on the front end of that curve. And I'm going to talk today about some of the lessons that we learned. It's really not to be aimed completely for a startup to swallow. I think in general, if you look at it from our perspective, you can think about how you can engage startups and how you can talk to them to better partner with startups and to get those solutions in. Because at the back end of it, startups add a lot to the equation. I'm going to end with the startup advantage. Startups have significant advantages, and I know anyone here who's in healthcare have a lot of expensive technology partners. Certainly startups can get around that in some ways. So the opportunity, healthcare, wow. Yeah, I don't know if you guys have logged on to a healthcare computer. There is some challenges in healthcare tech. I'm taking a SaaS perspective, software as a service perspective, but I think this applies to many device companies as well. But there's a huge opportunity with kind of dated, siloed systems, and it makes sense. A lot of times people beat up on legacy systems or systems that may not have the UX of a modern system, but that's because they've been around a long time. And guess what? Technology improves, and if you were to build a system now, it would be different than 10 years ago, than 20 years ago, and then 30 years ago. So there's a huge opportunity in healthcare SaaS for startup players, but also I see significant gaps as well in services. So the lessons I'm going to talk about today are the lessons that we learned as a technology player, and essentially how you could use those to shape how you would engage with a startup. So there's some of the lessons learned. The first one, as a startup player, Ash went into this in detail in her talk, that it is a long process to get technology introduced into the healthcare system. Now, a lot of times that's frustrated me, but I would be lying to say if it hasn't provided crazy value. The journey is valuable. It's like a marathon. At the end of it, you're in better shape. So first off, we started with the stakeholder engagement. That was kind of really an eye-opening process for us, where we actually got to validate our value proposition and then start to talk to people and learn firsthand what they were really dealing with. That's something a lot of startups, there's a body of research in this, but it's really difficult. Sometimes you get a lot of skewing when you talk to early users. You're talking to people who are very easy to accept technology, and it can really shape your opinion. But for us, we were actually talking to clinic managers, clinic staff. Okay. Eventually, we did patient as well, and managers, and we got a perspective for healthcare communications that totally changed the perspective we had going in, as well as further validated what I believed. The regulatory, legal, security components are significant. When we went into that, we were, we're secure, we're cloud-based. We went through with Amazon and all that stuff. We had to formalize all that, and it was a multi-year process that involved us reshaping our architecture. But none of that was an NLHS-specific process. It opened us up to being able to sell our software into other clinics and systems, which we're currently doing. Notably, we went down to the US with Scale Up Hub, and I'll mention Bounce in a moment as one of our stakeholders who helped organize that. And when we went down there, the first thing they said is, did you do this? Did you do that? Did you do a PIA? Do you have a monitoring platform? It was yes, 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 yes. They said, okay, we can do business with you. So the part of the journey makes you ready for the last piece, pilots and procurement, which is a challenge, but I think earlier this morning we heard some announcements about how that stuff is being sped up for innovation in Newfoundland. Regulatory and compliance piece, as I was saying, it's complicated and expensive, but it's also a valuable moat for startups. So, to take that away from your perspective, essentially, all of the time and energy that these technology players, if you end up working with young startups that they invest, gives them that level of rigor, as we were talking about previously, so that you can have the confidence in them. But for us as well, for TxtSquad, there's a lot of people that say, texting, how complicated is that? Oh, I can deploy ChatGPT too. Well, you've got to go through this process. It's a good moat for us to have. So it's been a huge value add for us. So this is more a pitch to startups to say, look, yeah, it sounds like a 2-year process, but it's not 2 years someone can make up on you in 2 weeks. It's actually a moat that you've built competitively around your product. The value of strategic partnerships, not just is Aon standing next to me here from Seafair, not just are they great to work with, the value that we got out of strategic partnerships are massive. So to the technology players in the room, build your strategic partner list. To the people who don't have a lot of startups as strategic partners, hit me up, okay? Let's talk. All right, I'm friendly. I do business. Let's do this. So Seafair, huge with us out the gate. They changed everything for us in perspective of how you do procurement. NLHS, they're potentially our end customer. They're our business partner. They're a gateway through which we have to meet requirements with regulatory, with legal. They kind of, wear a lot of hats in this relationship, but they're very much a strategic partner for us, and we have plans to go to market in other provinces together. So the strategic partnerships are hugely valuable. Tiny Seed is a Silicon Valley-based group of mentors that invested in us and nurture us and help us build our resources correctly. I'd also like to mention NRC have been hugely valuable in us, specifically building our AI component. We have quite a robust set of AI health agents, which we hope to be deploying in the next few years. And I can't not mention Genesis and Bounce. Bounce is in the room. I don't know if Genesis is in the room. Hugely valuable to us. So partnerships can be priceless. Okay? Healthcare SaaS is very high touch. You guys can see these pictures, right? Just to make sure. This is a picture at the West Clinic. And you can see some of the players in here. Trang on the end there. Everybody knows Trang. I think she is single-handedly keeping the Newfoundland government afloat. And, there's 3 TxtSquad players in the front. There's Melissa. Is Melissa here? Yeah, over there from Seafair as well. So it's very much a team-focused, high-touch process. And we were big on service before we got into this. Now I realize, thank God we wouldn't have made it otherwise, because you have to be ready for the human element. Finally, startups. To be honest with you, I put up the kitten. I think we're 7 years. I don't know if we're more of an old cat at this point, but we got one little technical glitch. So it's all those ones. So we have a natural advantage as a startup. So if you're on the other side of this equation, because I don't see a ton of startup hats in the room, but I see a lot of people that work for big healthcare players. What are the advantages that you can get from startups? And it's not just new technology. It's the clean slate that you can get from the technologies, I would say, is probably the biggest advantage. That is, right out the gate, when we deployed our cloud-based solution, it was just fully secure, best practice that Amazon said at the time. We set up the virtual private networks. We did the social engineering, the password keeper. Everything was best practice out the gate. So we didn't have any legacy software we had to worry about. So clean slate solutions are excellent. You can focus on UX. That was one of the things we did. We differentiated our system. It's incredibly easy to use. I would also say that one of the advantages is they can focus just on the MVP, the minimum viable product. What is the one thing? That's the hardest part for me. I want to just talk about AI and booking agents and then things that we can do for Epic admin, reducing admin burdens and all these things that I'm currently talking about right now. But really, you need to hammer your MVP. And for us, that's improving engagement and reducing no-shows. And you find that minimum viable product, it's really, when you tighten in the value proposition to what you're doing to a minimum viable product is where a startup can really excel. Whereas, legacy health players are always selling suites and suites of products, which can be so overwhelming to deploy. And finally, there's an opportunity for any startup to differentiate with service. So yeah, I hope that was valuable. I know people might come away saying, well, that's interesting. Maybe I want to hear a little more about how texting could change healthcare. Tomorrow, Aaron and I are going to be talking on that tomorrow morning at 3:30, so I expect to see everybody here tomorrow, and we'll get over that then. But I would like to thank NLHS for this opportunity, Seafair for bringing us into this space, and I hope everybody has a lovely conference.